Hello, and welcome to the learning topic of viral bronchiolitis. This presentation is brought to you by Cornerstone Pediatrics. The information on the site is available to you solely for general information purposes. Information on the site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on the site applies to your health conditions. Today we'll go over the following questions. What is viral bronchiolitis? How does it affect young children? How can I help my child feel better? What do I need to look out for? When will my child feel better? Viral bronchiolitis is a swelling of the lower airways called bronchioles. It is caused by viruses, and it is frequently caused by RSV, respiratory syncytial virus. Mild viral bronchiolitis may cause a cough and runny nose, a fever, without increased work of breathing or wheezing. The child may breathe faster, called tachypnea, but there typically isn't a lot of feeding difficulty. Moderate viral bronchiolitis can cause a cough and runny nose, fever, wheezing, mild increased work of breathing, some feeding difficulty, and this child may require oxygen, IV fluids, and inhaled medications. Severe viral bronchiolitis can come with a cough and runny nose, fever, wheezing. This child is having difficulty breathing, difficulty feeding. They may be agitated or lethargic, and they will need oxygen, IV fluids, and medical support. What do I need to look out for? Seek medical attention for a fever of 100.4 or above in an infant less than 3 months old, an increased work of breathing such as retractions, head bobbing or nasal flaring, grunting at the end of breaths. Retractions are when the skin sinks in above the neck, in between ribs, and below the rib cage when breathing in. Seek medical attention for increased wheezing, decreased feeding, or less than 4 wet diapers in 24 hours, or if your child is generally appearing more ill. Call 911 if they look like they are tiring out from breathing, if they pause in breathing for 20 seconds. This is called apnea, and it is more common in premature infants. You can stimulate the infant to breathe by tapping the bottom of their foot. Call 911 for a decrease in wheezing while breathing harder or tiring out, grunting while exhaling, or a blue, purplish, grayish color to lips, mouth, hands, feet, or anywhere on body. How can I help my child feel better? Encourage normal feeding if tolerated, or smaller, more frequent feedings. Offer electrolyte solution, such as Pedialyte, if not keeping breast milk or formula or other fluids down. Use humidity to break up mucus by sitting outside a steamy shower or using a humidifier. Use nasal saline and a bulb syringe to relieve congestion. Although fevers can be helpful to fight the virus, fever reducers may provide comfort to miserable children and encourage fluid intake. If nebulized medications have been prescribed, give as scheduled. When will my child feel better? Viral bronchiolitis tends to get better after a few days or after day 5 in RSV. Coughs may last up to a few weeks. Thank you for learning about viral bronchiolitis. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thanks for learning with Cornerstone Medical Group.